The COVID-19 death rate in the U.S. is far higher than other wealthy nations.
The death toll rose 39% over the past 2 weeks. The winter Omicron surge and low vaccine and booster rates in parts of the nation are largely to blame. Only around 27% of Americans received their booster, compared to other wealthy nations like Denmark that have more than 60% of the population boosted.
Authorities in Denmark cite its vaccination rate for its ability to get rid of most COVID-19 restrictions. Officials say the virus is no longer a critical threat, and vaccines could soon make it into the arms of the youngest population. Pfizer applied Tuesday for FDA approval of its 2-dose vaccine for children under 5 years old. U.S. health officials say this could be a critical step to end the pandemic in the U.S.
But how does COVID compare to other U.S. health crises? A New York Times opinion piece called "What We Can Learn from How the 1918 Pandemic Ended" looks at some of the similarities. John M. Barry is the author of that article, and he joins us now to talk more about it. Welcome, John. It's great to have you with us. You know, in your article, you write about how the 1918 influenza pandemic lasted longer than most people actually realize. So can you explain what you mean by that?
Well, it's a lot like what we're going through now. People got tired of it. Most histories, and even the CDC website, say that there were 3 waves, starting in the spring of 1918, ending in the spring of 1919. And by far the deadliest wave was the second wave in the fall of 1918. But the reality is, if you look at the numbers, there was a 4th wave in 1920. People ignored it. They went about their business. And in fact, it was quite deadly in a lot of cities, Detroit, Kansas City, Minneapolis, pretty big cities. It was actually the deadliest wave. But again, like today, people got weary of it and they simply decided to move on. In fact, in the presidential election in 1920, the slogan for Harding, who won the election, was "Return to normalcy."
John, in 1920, most people had pandemic fatigue and went back to life as normal. That led to a slew of deaths. Do you think that is where we are headed with this pandemic, as people say they want to move on and get to a place where COVID is endemic?
Yeah. Well, that's one of the reasons I wrote the piece. I would like people, not to live in a box. I go out, but recognize that the virus is still out there. Omicron is less virulent than Delta, and yet our weekly average death toll from Omicron is higher than it was from Delta because it spreads so much more easily. More people are sick, and people have gotten tired of taking any precautions. You can do common sense things to continue to protect yourself, and that helps to end the pandemic. Obviously, the vaccination booster, we've got therapeutic drugs that are quite effective coming in online. We don't have many of them yet, but they'll be out there. Just use common sense and don't expose yourself. Japan has had a tremendous success, and their population follows what they call the 3 C's, which is avoid crowded spaces, closed spaces with poor ventilation, and avoid crowds. And they wear masks. And their per capita death toll is, much greater, much better than ours.
John, I loved your piece because it reminds us that there's a reason we study history, and one of those reasons is that we don't repeat the mistakes of the past. And clearly, we are in danger of doing that a bit when it comes to COVID-19. We all want to move on so rapidly from this. We're tired of it. We're fatigued, just like people were after, in 1920. So what should we remember about what we have now? We have these amazing vaccines that are available to us. We have these booster shots. So we shouldn't get complacent about keeping up with our inoculations, correct?
Well, you're exactly right. I mean, we know that immunity wanes from the vaccine as it does from natural infection. Get the booster and protect yourself and protect the people around you.
John M. Barry, thank you so much for joining us. We really appreciate your historical insight into this.
Thank you.